So I'm only going to take 2 or 3 minutes just to really go over the program itself, and we'll jump more importantly, I think, into the case study with Sandeep. But the program itself, so we are a NHS England funded program. So we're running partnership with the 15 health innovation networks and lots of other different partner groups across the NHS and the ecosystem. So we run a 3-year fellowship program, um, really for the brightest and best of digital health innovations across the country. What we concentrate on is really within the SME space, so similar to sport to the health innovation networks, mostly software as a medical device and kind of back end non-clinical efficiency solutions as well. We do some med tech as well. So, for example, Cited with the Cited sponge, some of you may have heard of that one, but we don't generally touch therapeutics or kind of the larger scale EPRs, for example. We're very much kind of focused on the SME space. What we try to do with these companies is really 3 things. So it's curating, it's guiding, and it's connecting as well. So curating, the role of the program around curating of these innovations is really for the benefit of systems themselves and local system partners within trusts, within ICBs, wherever that may be. And it's really trying to pick out what are the most exceptional innovations on the market at the moment that are working somewhere in the NHS, and how can we tell you about them? So to get onto the program, you need to be live in at least one NHS site. And that's kind of outside of a pilot phase as well. And what we really try to do is pick out the solutions that are working at a local level, and then how can we expand them from local level to regional to then multi-regional as well. Really picking out what's working, what do you need to know about it, and then presenting it to you guys. And that's hopefully one of the things we'll go through today. There's also the guiding part of the program as well. So the guiding element is how can we take innovators through the complex NHS market? So there's 2 elements to that really. There's the learning program that we do, and these are quarterly and also kind of bi-monthly events that we have with everyone. And we focus on a really well thought through and put together learning program, which covers everything from health economics, evaluation, health inequalities, procurement, patient public involvement as well, really guiding them through masterclasses. And we've developed what we call a maturity matrix, which we're starting to roll out into the program, which is really focused on how can we get these companies from stage A to stage B to stage C, which is really everything that the NHS would need to see from these companies when it comes to all those parts. So, for example, evidence evaluation and public patient involvement, for example. One of the other parts that we really want to do when it comes to the guiding of the innovators as well is the other stage of the quarterly events that we put on, which are really focused on connecting them and helping senior leaders from NHS England, Department of Health and Social Care, and actually from systems as well. So whether that's kind of CCIOs or chief financial officers from ICBs, really coming in and telling them exactly what is it that you guys are focused on at the moment and what can they do to best help and serve those needs of the system. Again, it's important to highlight that we're 100% NHS England funded. So this program is specifically for systems in the NHS itself. It's not for the innovators itself, but we can really we can get a win-win situation if we can get these companies to exactly where the NHS needs to adopt them at scale. And then finally, it's connecting. So that's connecting these proven innovations to the NHS, so based on system pool. So it's likewise what we're going to hopefully try and do today with Romecare, but it's also at the policy level, it's at the NHS England leadership level as well. It's with Department of Health and Social Care. It's really making sure that they're connected into everything that's happening from funding, for example. So you probably were all involved with HTAF last year. We had some influence at the beginning of it, but we really tried to make sure that fellows on the program knew everything they needed to know as and when that came around, to make sure that they were primed to make the most of that. Just some really quick numbers about the program. So this program's been going since nearly 10 years now, since our 10-year anniversary. The fellows on the program are spread to over 3,250 plus sites, about 1,000 new roles created. So some of the companies you probably would have heard of or are Doctor, Patients Know Best, Nerve Centre, Sleepio, Open Medical. About 75 in total have gone through the program. We've got about 30 on the program within the current years 1, 2, and 3 at the moment. Now, the important part to really get into as well is the assessment process. So, as I said at the beginning, a lot of this program is around curating the brightest and the best of the digital health space at the moment. So the application process remains the same, and we're really trying to do a lot of the due diligence that you guys would have to do when it comes to procurements or kind of horizon scanning at the beginning for you to really identify a list of here's what's working, as I said, within the system at the moment, and then how can I adopt that within my local sites. So I'll just walk you through the assessment process. So we have an annual application that opens every year. Do this in September, the same time every year. Our applications are reviewed by clinical experts from across the NHS. So we try to get anywhere between 3 to 5 experts to review each application that comes in. So those experts are generally, they're usually CCIOs, are quite a few of them, depending on the application that comes in, what therapy area it's working in. We sometimes have all the way up to kind of national clinical leads or medical directors have a look at some of the applications, but generally it's on the more on the ICB level. Once they're reviewed, the applications are then also reviewed by NICE and other national bodies. So that's the National Health and Equalities team, so Balola Wabi's team, the Net Zero team from Greener NHS as well, all do a informal review of these applications. So they don't give us formal guidance, for example, like an EVA or something like that, but they will give us a steer as to, is this something that we should be taking on and what's their opinion on it. Once that's been conducted, the applicants are then invited to an interview panel. So that's a panel of commercial, clinical, patients, and implementation experts. And again, we have CCIOs, we have clinical leads on there. We also have commercial experts from health innovation networks. We have third parties as well, like Health Foundation. We're looking to get involved in this year's too. The numbers that generally come in have about 150 applications every year, and about 20 or 30 get to interview. And once those interviews are conducted, we then have our final review board, which is the NIA board, which is chaired by Stephen Powis, and we have a number of kind of NHS England senior leadership on there as well, like director of Accelerator Access Collaborative, for example, and a few chief officers of health innovation networks. We also have representation from the National Health and Race Observatory and also the Health Foundation. References are finally requested from each fellow as from their actual provider sites, which have already commissioned them. As I said, this has to have already been used in the NHS to actually get onto the programme. And then finally, we conduct some due diligence with some more partners like the Crown Commercial Services, for example. So we make sure that they're on all the relevant frameworks and they hit the standards needed to be able to be adopted immediately. And then finally, we do some financial and also some cybersecurity due diligence, including DTAC and all the normal ones that you would expect to come with IG. And then we finally launch it. So it's a really long process when it comes to the due diligence side. But what we're really trying to achieve there is making sure that the companies that come onto the program hit the standard needed to be able to be scaled within the NHS. And anything that they don't quite hit, we can then have a clear plan over the 3 years that they're with us that we can work with them on. And as I mentioned, one of the key things we're really trying to do is pick out what's working and then how can we highlight it in the system. So not just show you this is what's working in the NHS at the moment at a local site, but also how did that happen? So what was the implementation journey? Where did the budget come from, for example? What staff were needed to actually implement this? What was the journey I had to do to convince, for example, the CFO in my site to actually get bought into this?